Welcome to It's Your Case, presented by vetcity.com. I'm Virginie Barberet, your radiologist on demand for this week. Today's example is a 13-year-old cat with severe inspiratory and expiratory efforts. We are presented with a set of two thoracic radiographs, one lateral and one dorsal-ventral projection. So let's look at the important findings on those radiographs. First, we can see that there is a moderate diffuse bronchial pattern appearing as thick rings and also some trim lines. There is also suspicion of some increased branching and nodular soft tissue opacities in the periphery of the lungs, which could represent some bronchial plugging. The second important finding of those radiographs is the pulmonary hyperinflation. You can see that the caudal tip of the lung lobes is reaching the level of L2 vertebra, which normally it should be more around L1 vertebra or T13. But we can also see that there is flattening of the diaphragmatic outline, which indicates some quite increased pressure on this diaphragm, and you can see it as well that there is a bit of tenting of the diaphragm on the ventral dorsal-ventral projection. The third main finding of those radiographs is the presence of chronic rib fractures. So we can see here that there is some disruption of the rib, and there is also some bridging new bone formation. So those fractured ribs here are quite chronic because there is already some callus formation and are partially healed. You can see that the 13th ribs are also a bit wider at some levels, which could indicate some previous but completely healed rib fractures as well. So to summarize, we have a diffuse bronchial pattern, which is moderate, but it could also be that it's appearing less severe as it would be because of the pulmonary hyperinflation. There is a bit of bronchial plugging suspected, and there are some rib fractures, chronic rib fractures. So with all those findings combined, chronic lower airway disease is considered more likely, whether it's allergic, so like with feline asthma, or eventually also it could be septic, but an allergic cause could be considered more likely in that case. So with feline asthma, there is bronchial pattern, and there can be some bronchial plugging with some mucus obstructing the bronchi, the lumen of the bronchi. This could induce some air trappings with the air coming into the lungs but having trouble to get out through the bronchi, so inducing the pulmonary hyperinflation. But then there could be also some chronic rib fractures or rib fractures appearing because of the severe respiratory distress that can be seen in some of those cases. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your question on social media.